Hello everyone, Michael Peluso with TCM Gynecology. Today we're going to talk briefly about the phenomenon known as PMS or period flu, and we're going to talk about a couple of mechanisms that may be responsible and are commonly responsible during this period causing this miserable condition. So as we know from physiology, we start with the heart chi every month, making sure that blood makes its way down to the uterus along with the kidneys, pardon my art, sending essence. And this is the normal physiological process that occurs on a monthly basis in order to ensure menstruation goes off without a hitch. Problem is it's a blood and yin intensive process. And oftentimes, if the spleen is weak at all, or the liver gets stagnated and horizontally invades the spleen, weakening it further, we get many of the signs and symptoms from there that will constitute the signs and symptoms of this period flu. For instance, oftentimes headaches can occur with period flu. If the spleen is weak, and it's a statement of fact that defense chi or wei chi issues from the middle jiao, that means that there's a weakness or a deficiency in wei chi. That means the wei chi is not protecting the upper part of the body, the head and the neck, which leaves it open for exterior invasion. If there's an exterior invasion of cold, that can obstruct the free flow of qi within the vessels of the neck or upper body, and it can create some of those symptoms associated with a headache or even the achiness and that type of thing that comes along with flu-like symptoms. If the spleen is weak and it's causing a relative blood vacuity, that, of course, will affect the liver. Why? Because the liver depends on blood to nourish and emoliate so that it can do its job of free coursing and discharging qi throughout the body. If the liver becomes stagnated or depressed from a lack of blood, it can, again, horizontally invade the spleen. It can also cause liver qi depression, which will result in irritability. If it invades the spleen and further weakens the spleen, it can lead to things like dizziness or fatigue. Also, the liver can horizontally invade the stomach. If it invades the stomach, oftentimes when the liver becomes stagnated, it transforms into heat. That heat is transferred to the stomach and oftentimes can result in things like vomiting, nausea, so what we would see as a counterflow qi pattern. So these are things that we see often clinically, and this is just a brief tip or introduction to this process, but not unusual at all to see this middle jiao become disrupted, and then from there, sort of the cascade of signs and symptoms that we associate with period flu can then be made manifest. So, small tip here, think about the middle jiao, pay attention to the liver, spleen, for anything that's happening premenstrually, and the liver especially for things that are happening during the menstrual period. This will give you shortcuts, ways to think about things in clinic so you're not spinning your wheels and wasting time with your patients. Hope that helps you.